Can you name 3 categories that STIs fall under?
No, what is that?
Can you name 3 different categories that fall under the STI?
No, what is that?
Can you name 3 categories that STIs fall under?
No, I don't know what you're talking
Are you aware of the different STIs in the world?
I mean, I know they got herpes and HIV and chlamydia and syphilis and
That's all you know?
pretty much.
about. Any?
Are you aware of the different STIs and different STDs in the world?
No, I'm not.
Do you have protected sex?
No, I do not.
Are you aware of the different STIs and STDs in the world?
Not really.
Are you having unprotected sex? What do you think is the most common STD, STI in America today?
Common, I would say syphilis and chlamydia because you find more people having it nowadays than herpes and
How do you know when someone is infected?
Well, from a man point of view, I just think like a women private area be like have a weird stench or smell to it, or they be leaking. Or that's what I think. I think
From my
it's leaking.
perspective, if you see a woman's private area leaking green stuff, just gotta go. Has to go.
I can disagree with the stench and the smell because it also could be a yeast infection, or it also can be a urine infection, but those are curable. Those are naturally, you can naturally have that from washing powder, soap, or anything.
But still,
No, I disagree.
that's just a
No,
that's
but the green stuff, I agree with you.
that's one step away from something that could be totally horrible.
Well, then go get checked then.
Yeah, I agree with
Can you name 5 different STIs?
you. Gonorrhea, chlamydia, syphilis, HIV, AIDS.
That's 5. Can you name 5 different STIs?
You have syphilis, chlamydia, you have herpes, you have AIDS, you have gonorrhea. Pretty much,
Can
yeah.
you name 5 different STIs?
Top five I know is syphilis, gonorrhea, chlamydia, AIDS, and herpes.
How do you know when somebody is infected with an STD or STI?
When the vagina is swollen and when the penis is burning when you take a piece.
Have you ever had sex before? If so, you're at a greater risk of having a sexually transmitted infection from either a partner that has had multiple partners or from having sex without using protection. Okay, so now we're going to talk about the different types of sexually transmitted infections, also known as STIs. So the first one is syphilis, the second one is AIDS, the third one is bacterial vaginosis, and the fourth one is pubic lice, also known as crabs. Next, we're going to go to the most common. The first one I like to talk about is chlamydia. It's actually caused by a bacteria called chlamydia. Next, we're going to talk about gonorrhea, also known as the clap. It's green and it has pus. Next, we're going to talk about genital herpes, which is marked by genital pain and sores.
Many people today don't understand the risk that they have of catching an STD or a STI. Many Americans today, as we seen in the beginning of the video, don't know the different type of consequences that come with having unprotected sex. If you are having sex, oral, vaginal intercourse, genital touching, any of that, you're at a risk of catching an STD or STI. STI symptoms aren't always obvious. If you think that you're having any symptoms of any type of anything after sexual intercourse, you need to come see me and my group because we have a special product for you. So the first STD, STI we're going to be talking about today is chlamydia. The symptoms for this disease is painful urination, low abdominal pain. You have a testicular pain in men. Women have a colorful discharge that comes out of them. It's very smelly. It has like a very strong pungent smell to it. You also get discharge from men as well. Same concept. It has a strong smell to it, and it also has a color. So next, we're going to be talking about herpes. Herpes come in the form of genital or oral. For oral, the symptoms are you can get cold sores if they're untreated. they'll begin to get really, really big and pussy, red. For genitals, you'll get bumps, ulcers. You end up getting like a lot of ulcers and bumps inside of your vagina, which makes it very hard for you to use the bathroom. For men as well, you end up getting them around your penis. You end up having headaches, muscle aches and fever, lymph nodes around your groin, and the infection just goes out of control when it's untreated. Herpes is not curable, but we do have a cure for it. Now we're moving on to the hepatitis stages. There's hepatitis A, B, and C, which is very contagious and viral infection to affect your liver. These symptoms include fatigue, nausea, and vomiting. You have a high fever. Your urine will be very dark. You'll have muscle and joint pain. You have a lot of itching in those areas. You end up seeing yellow towards your skin. And also you'll have a lot of abdominal pain and discomfort, especially in the area of your liver. Syphilis is a bacterial infection. These signs of syphilis may occur in 4 stages. We have the primary, secondary, latent, and tertiary stages. Most times syphilis occurs whenever you're pregnant. These symptoms are kind of similar to the chlamydia, where you have the cottage cheese kind of discharge coming out of you and has a very pungent smell to it. You also have the itching of the vagina, itching of the anal. You also might see little ulcers as well, but they'll go away over time. And the first signs may occur within 10 days to 3 months after exposure, and it might be a little painful, but it's not as bad as the other STDs out there.
As you guys may know, there are many STDs and STIs in the world. Some such as chlamydia, gonorrhea, syphilis, herpes, AIDS, HIV, and so on. Some of them have cures and some of them do not. Chlamydia, you can go to the doctor, get cured for that, but AIDS, HIV, and herpes do not have a cure. Many people can die from AIDS and HIV, and if they have herpes, sometimes herpes don't show up in their system until 10 years from now. When you have AIDS and HIV, you have to take a lot of medicine, and your body has to become immune to this medicine, but we came up with a creation called DAT1PILL. DAT1PILL basically cures any STD or any STI. DAT1PILL, you have to take it twice a day. It's only prescribed by your physician or your doctor. You cannot get it over the counter, and the doctors and the physician have to give you a certain amount based on your body type. If you're bigger, then you may have to take more. If you're smaller, you may have to take less. You take it for about 2 to 3 weeks, but while you take it, you have to follow the rules, such as you cannot have sex. If you have sex and get reinfected, then the pill will not work, and you have to start your healing process all over again. With this pill, it has some side effects, but you will not have to worry about taking medicines for the rest of your life. You will not have to worry about the burning anymore, the itching, the green stuff. You won't have to worry about none of that, or the stench. When you take this pill, the side effects that comes with it is the guys, you will shoot blanks. So, when you're done, it'll be water. You will not be able to get anyone pregnant for about 2 to 3 weeks after you finish taking your pills. And women, that's why we just say no sex, because women won't be aroused. Like, they won't get happy. Like, their hormones will literally be just, no. Like, it won't be lubricant. Like, it would literally just be, dry. So, with that being said, no sex for 2 to 3 weeks, but after that, your body goes back to normal, and everything will be okay. So if you do find yourself going through changes with a sexual partner, or burning, or have a stanky smell or something, you can talk to your physician, and based on your body type, they would prescribe you DAT1PILL. We recommend this to everyone, and after about a month, your life will go right back to normal and you will not infect anyone. That's all.